During the past year, the COVID-19 pandemic and social justice movements have sparked new conversations about health and healthcare disparities faced by people of color, especially when it comes to access, discrimination, and trust in the healthcare system at large. And Dr. Carl V. Hill is with us now to discuss what can be done to overcome current barriers to improve, in particular, Alzheimer's and dementia care. Good morning, doctor.
Oh, good morning, Aubrey.
So what are some of the key findings from the 2021 Alzheimer's Association report when it comes to race, ethnicity, and Alzheimer's?
Aubrey, the Alzheimer's Association has previously reported that there are disparities in the risk for Alzheimer's or other dementia. So we wanted to dig a bit deeper to understand what some of those specific factors or barriers could be for that create and sustain those disparities. So these surveys found that more than 1/3 of Black Americans and nearly 1/5 of Hispanic Americans and Asian Americans believes that discrimination would be a barrier to receiving Alzheimer's care. Also, really importantly, half of Black Americans and almost half of Native Americans reported that they have experienced racial discrimination when seeking health care. So, these are really eye-opening findings that really link to a call for action.
Yeah, definitely. And talk about the pandemic as well and how that has impacted the findings in the report.
Well, we know that discrimination and lack of trust have all been a part of a long-standing health disparities in the United States. The COVID-19 pandemic has underscored the impact of these disparities in the current system. Black, Native American, Hispanic communities have been hardest hit with more hospitalizations, more deaths, and more cases than whites. So the pandemic is just shining a bright light on what we have been noticing for years and what we continue to notice with Alzheimer's and other dementia.
And when we talk about some of the current barriers for non-white Americans when it regarding treatment and care, what are those?
This report, identifies discrimination and really a lack of trust in the healthcare system as being a really important barrier. So we've observed for years the influence of structural racism and how that influences people's access to quality healthcare. But it's really striking to know and to learn that once these racial ethnic populations access care, they experience discrimination in the receipt of Alzheimer's and dementia care. So really important findings for us to use in our pursuit of health equity in Alzheimer's and other dementia.
Any other reasons why this lack of trust is really still existing to this day?
Well, there are a number of factors that could be in play. There's a lack of familiarity, so a need for more diversity within the healthcare system. It would be great to recruit and retain more professionals in the healthcare system that look like and come from the communities that we would like to engage. Cultural competence here, Aubrey, is really important. So being sure that healthcare providers are trained and have certain standards in the delivery of care that is culturally appropriate and sensitive, but also, as you mentioned, really honing in on trust, engaging communities, working with community-based organizations, so that we all know how important it is to address these disparities in Alzheimer's and other dementia.
Doctor, anything else that should be done to address discrimination? I mean, how can the healthcare industry become more inclusive and progressive if we want treatment equality?
Yeah, good question, Aubrey. It is leaning on diversity, being more inclusive, being diverse, recruiting diverse staff at all levels, at all opportunities within the healthcare system, really focusing in on culturally competent care and developing, I think, places like the Alzheimer's Association, prioritizing the development of relationships with the African Methodist Episcopal Church and other national organizations that have a local presence, a local footprint in communities all over the country, so that we can get the word out about the importance of reducing risk with information, with seeing a doctor, with knowing the 10 warning signs for Alzheimer's and other dementia.
All right, Dr. Carl V. Hill talking about racial disparity in healthcare. Thanks for joining us this morning. And you can visit their website if you'd like to see more information on this topic.